Do you need to strengthen your core for low back pain? Or is core exercise overrated? Are we just babying people? Should we be pushing people into different types of rehab? If core exercise is indicated for low back pain, is it for everybody? Or is there a specific subset of the population who's going to respond really well to core exercise, whereas other people need to, maybe some people need to do the exact opposite. Maybe they need to relax their core. We're going to find out in today's episode. Hey, I'm Dr. Anthony Davis with Shapeshift Wellness, and this is the Health or Hoax podcast. I teach people with chronic pain and recurring injuries to reclaim the active life that they love through lifestyle interventions such as movement, sleep, nutrition, stress management, and that way they can get back to doing the things they deserve to be doing. If you ever want to book a one-on-one call with me, you can book a free discovery call. The link is in the description. All right, let's get into it for today's episode. Is core really important for low back pain? Why is it that every fucking physical therapist and chiropractor in the world tells you that you need to strengthen your core for low back pain or to prevent low back injuries? Well, first of all, this just bugs me because basically we end up with therapists taking the exact same silver bullet approach to every single patient with low back pain, which is crazy because every single patient with low back pain is unique and should not be getting the same treatment. That's why therapy fails so much. That's why rehab fails so often, especially for chronic pain, because everybody's given the same bullshit treatment. So even if core exercise is very useful for some patients, there's absolutely no way that it is the magic bullet for every single person with low back pain. So there are many systems that emphasize core training like DNS, and they are good for the right patient, but there are many DNS practitioners who give core exercise to fucking everybody. You come in with neck pain, guess who's doing, a 3-month supine position? You come in with shoulder pain, guess who's doing some type of a plank variation for core stability? Who's doing 3-month supine, right? I fucking swear to God, if I see one more person with ankle pain get fucking core exercises, I'm going to lose my goddamn mind. It is ridiculous. We need to do better as a profession, okay? Not everything can be boiled down to a single solution. Okay, so any therapist, I went on a huge rant about this in a recent episode, and we talked about all the reasons to avoid your doctor, or how to spot a bad doctor. And one of the reasons is if they do the same thing for everybody, then they are not really treating you. You've got low back pain, core exercise. Low back pain, core exercise, right? Oh, you've got neck pain. All right, let's just do chin retractions. Oh, you've got sciatica. Okay, we're just going to stretch the piriformis. Like, come on, learn a new trick. It gets old. Okay, I say all that, but let me give you an anecdote about using core stability training in practice. For acute cases of low back pain, acute meaning it just happened, especially if this is the first time that anybody's ever had low back pain and it flares up really bad. They just moved a really, really heavy couch and then they got a sharp shooty pain in their low back and it goes down their leg and they're coming in for the first time and they're in like 9 out of 10 pain and they can barely stand up. Sitting hurts, laying down hurts, everything hurts like crazy. What do we do with these people? How do I get them better? And I'm telling you, I have had so many patients who come in and they can't even stand up from seated without lots of help from their hands and wincing in tremendous pain. They cannot roll over in bed. They cannot squat down. They definitely cannot bend forward because that really shoots down their leg. And yet, by the time I'm done with them, they are leaving my office doing deadlifts. I'm not fucking kidding. They are leaving my office doing deadlifts. They are leaving my office doing squats, all right? With weight sometimes, not always with weight. And when I say deadlifts, I mean at least the deadlift pattern with body weight If not, sometimes they are doing deadlifts with weight. Now, it's lightweight. We want to start with them with lightweight. I'm not reckless. I'm not stupid, but we're getting them into really, a higher level of exercise, and they come in almost completely disabled. Okay. How do I do it? Part of it is core exercise. Okay. So I just teach them a trick. I teach them a trick to stabilize their core so that their low back does not move or bend or twist while they do transitional exercises. So I teach them how to use their breath to breathe into the belly and use the breath as a brace to stabilize the low back musculature and joints and ligaments and discs. And then I have them hold that brace while they're doing a transitional movement and then exhale when they're done doing the movement. For example, you would inhale, if you're going to do a squat, you would inhale, take a big breath into the belly, hold it, squat down, and then as you rise back up, you would exhale. That way, your back is less likely to move while you're doing the thing. This totally shocks people. People think I'm a goddamn wizard. People literally think I'm a wizard. They think I'm magic, and I'm not magic. I just gave you a trick. Now, it's a temporary trick. This is the biggest thing. Some people also come into my office and they have had a therapist teach them this low back stabilization stuff. And now they come in and they're excessively bracing. They brace every single time they move, but they're only experiencing like 3 out of 10 pain. Why are you tensing your abs so hard all of the time? Why are you breathing so dramatically just to bend over and put your socks on? That's ridiculous. Relax. You need to relax. So this is the problem. I have seen tremendous success using core stability for acute patients with severe sudden onset of pain. But the opposite is true for chronic pain. So chronic pain, oftentimes I need to teach somebody the opposite. I need to have them unlearn the core bracing. I need to teach them how to relax. Now, somebody from DNS will tell you that real core stabilization is just breathing naturally. So it is not excessive tensing. It is not excessive bracing. It's just normal breathing and stabilizing through the breath and the actions of the diaphragm and transverse abdominis. And I agree, it should be relaxed, but you also shouldn't have to think about it, right? So if somebody has chronic pain and they're excessively bracing, oftentimes I need to teach them to chill the fuck out and stop overthinking it. Now, this is where I come to issue with DNS oftentimes, is that the real old school, by the book DNS people will tell you that you should never bend your spine or rotate your spine ever with your lumbar spine, because it is supposed to be there for stability. And that is just false. That is completely insane and unsupported by the scientific literature. Every time that we do a study on bending the spine, we find that it is perfectly safe to bend the spine, especially without heavy load. So things like crunches are fine. Okay. So there's no reason to be afraid of bending the spine. Okay. In fact, when people come in with sudden severe pain and they cannot bend the spine, I don't tell them, don't bend your spine forever. What I tell them is, right now, while it's sensitive, I'm going to teach you a trick that involves less bending of the spine so that you have less pain until things calm down. But as soon as things calm down, I want you to start bending the spine as tolerated until you can do it normally. So the whole idea of core stabilization and why you would want to do core exercise for low back pain is that by stabilizing your core, you're preventing unwanted motion through the spine, the lumbar spine, and that movement would create damage or pain in the lumbar spine. And again, I want to repeat, that notion is totally unsupported by the research. In fact, the research shows the opposite, that there is no increase in pain or injury with people who bend their spines on a regular basis. The other notion of core stability is that you need to be able to activate your core quickly when you're doing motions, and that if you have a delayed onset in muscle firing, that you will have more low back pain. Unfortunately, again, this is not the case. We see no correlation between firing growing patterns and onset of pain or degeneration of the spine. The next thing I want to talk about is that the core exercises that we actually choose for patients are total bullshit anyway. We literally baby people. So this DNS stuff, I realize I'm taking a huge slam on DNS. I love DNS. I think DNS is amazing for the right patient. I just don't think it should be applied to everybody all of the time. I think that's crazy. Anyway, this stuff comes out of Prague, and the way that they came up with this stuff is that they observed babies. That's it. They watched a bunch of babies rolling around, crawling, and learning how to stabilize their trunk so they could stand up and do stuff. Fine, that's cool. Observational science is still science, but it's not the best kind of science. It's not randomized controlled trials. So it's observational data, not entirely. There are other studies that are involved here, but largely this entire system was built on observing babies, and we're applying baby biomechanics to adult human beings, and it just doesn't apply. Adult human beings have different shapes, different proportions, different muscular integrity, different joint shapes. Everything about us is different. So it may have some application some of the time for some people, but it certainly cannot be perceived as the gold standard for all people all of the time in all athletic endeavors. And the bigger point here is that the exercises that they do in DNS, and I've seen this kind of rehab constantly with patients who have pain, and even after 8 weeks of rehab, they're still doing baby exercises. They're crawling on the floor like a fucking baby when they should be doing adult exercises like doing a squat or doing a deadlift, right? Or doing a lunge or jumping or running or doing whatever it is that they care about. If they do jujitsu, they should be training. They should be able to get back to training, right? If they bicycle, they should be getting back to a gentle stationary bike before they go on a heavy bike ride, right? We should be easing them into harder and harder activity. And it's fine. All of this baby stuff is fine. These exercises are really good skill development exercises. But once you develop the skill, now it's time to practice that skill in a more difficult exercise. If we start with a baby exercise to teach you how to breathe and brace, eventually let's get you to do. Oh my goodness, my words. It's been a long weekend. Quick side note. I have been moving all week. It is hard. And if you have weeks like this where you are totally exhausted, it's time to get rest, rejuvenate, get plenty of sleep, eat good food, because your allostatic load is high. This week, I have not done a single workout, okay? Because I'm moving, and I'm moving very heavy things every day to move both my personal and office stuff to a new location. And so I'm not doing any traditional exercise this week whatsoever because my allostatic load is so high, and I'm already getting plenty of exercise in the form of moving. So anyway, let's get back to the point here. The point is that we should be progressing people to more difficult exercise, okay? That doing, breathing and bracing and planks and stuff like that is good as a start, but we need to progress further from there. And besides, if we're worried about actually getting good core engagement out of an exercise, we see way more core engagement through an exercise like a deadlift or a squat or heavy exercise or even a bench press than we do from doing a plank. So if you want to strengthen your core musculature, you should do heavy weightlifting because it's way better than doing core specific exercises. Hey, real quick, if you've struggled with rehab and you've had chronic pain and recurring injuries over and over and over throughout the years, especially if you've been tossed around from physical therapist to chiropractor to physical therapist, and you've been doing the same types of exercises with every single person, how about instead of trying to do the same thing over and over and over and over again, which is the definition of insanity, why don't we try something new that gives you a solid step-by-step plan that accounts for you holistically as a whole human being, biopsychosocial, everything included, and gets you to reclaim the active life that you deserve to be living. If that sounds like you can reach out and have a free discovery call with me. I can work with you from anywhere in the world. If you're in Colorado specifically, I can see you in person. Okay, so let's get back to the episode. When should we teach core stabilization? Who should we teach it to? In my opinion, if you have acute pain or severe pain, then it is a really good time to teach you the skill set of core stabilization, because you can dramatically impact the level and the severity of your symptoms during transitional movements, so that as quickly as possible, you can return to normal life. You can still walk around the house. You can still get up out of the bed. You can still sit down and get back up off the toilet. You can do your normal activities, because this core stabilization and excessively bracing and breathing into the core will alleviate your symptoms while things are extremely flared up. So I think for those people, core exercise is almost magic. It's amazing. It works so well. It's fantastic. However, the opposite is also true, right? So if we are seeing chronic pain and excessive amounts of bracing, and you've already tried the core progressions and it doesn't work, maybe it's time to do the opposite. Maybe it's time to relax, teach you relaxation techniques for the core. So rather than stabilizing, we teach you how to relax your core. And then the last point, and this is my biggest gripe with core exercises, is that it's endless. We just do core exercises forever, and we never progress it. Now, I do think that core stabilization as a skill set is useful as a building block for more functional athletic endeavors. If we're doing high skill, high intensity athletic or functional training, then we do need to have good core stabilization. But the core stabilization should be the underlying foundation upon which we test this more advanced skill set of athleticism. So do not let the core stabilization get in the way of progressive training and reaching that athletic potential that you might be after. So the main point here is that you do not need to brace all of the time. That's the biggest thing, is that we don't want to create this fear of movement where you are afraid of bending your spine, twisting your spine, lifting, side bending, forward, backwards bending, where you think that you need to have a perfectly neutral spine all of the time. That's just not true. If that was true, then for your own safety, we should surgically fuse all of your lumbar vertebra. Right? I mean, think about it. Think about this logically. If it was better for your spine to not move your spine, wouldn't we want to surgically fuse everybody's lumbar spine? That would guarantee that we don't have excessive, loose air quotes here, but unwanted movement in the spine. But of course, that's not the case. That would be ludicrous to fuse everybody's spine. Why would it be ludicrous? Because we know that the health of tissues, the health of your joints, your ligaments, your muscles, your tendons, your bones, relies on movement, especially the health of your discs and the health of your joints is reliant entirely upon movement, because they do not have a blood supply of their own. So the only way that your joints get nutrients and oxygen so they can rebuild and become and maintain health is through movement, because movement flushes the fluids in and out. Therefore, it flushes nutrients in and out of your joints. So without movements, then you would guarantee you have degeneration of the spine. So in order to have a healthy spine, we have to move. Therefore, core stabilization is overrated. It is extremely valuable for a short time as a temporary strategy for the right patient. It should progress. It should progress into more difficult exercise over time. It should not be the only form of treatment. And when you do stabilize your core, it should be effortless through breathing, not by intense bracing. So even if you're going to train core stabilization, relax, be chill about it, be cool, be calm about it, right? Breathe into your diaphragm, breathe into your belly. That natural breathing is a natural brace. That's it for today's episode. If you have questions, leave them in the comments. please like and subscribe, leave a review. It really genuinely means the world, and it helps to get this information out to more people who might be suffering with chronic pain or recurring injuries. And if it helps them to get back on their feet, if it empowers them to reclaim the active life they deserve to be living, then you have helped a fellow person to get back to their goals. And you are therefore a good person. That's it. That's how that works. You're a good person now. I guess that implies that if you don't share it, you're a bad person. I think you might be a bad person if you don't share this episode or leave a review or like or subscribe or something. I'm pretty sure that's logically that follows. All right. Thank you so much for watching. I can't wait to see you in the next episode.